Hello, my name is Alina Russell. This is a PowerPoint presentation of the community plan uh, in Medina County of Cleveland, Ohio. And it will concentrate on the highlights of the windshield survey for Medina County, healthcare issues persisting in the chosen healthcare setting that we have at Kindred Hospice. I am a hospice nurse. Been doing this for about 9 years and been doing things in between. Presentation will also talk about the community assessment, such as partners, the resources, the diagnoses that we have in the community, and the community health plan. We have also proposed interventions, evaluations plans. So Medina County is a county in the United States of Ohio. As of 2020 census, the population was 182, 470 residents. And the county was created in 1812, later organized in 1818. It was actually named Medina after a city in Saudi Arabia, which in research, I did not even know that. The windshield survey I've included in Medina County, such as they have the boundaries, the services offered, such as marketplaces, schools, neighborhoods, shops and malls, and hospitals. We have great hospitals with especially like Cleveland Clinic. I worked at the main campus, ICU step down, and I learned a lot. So neighborhoods, organization for the children, whatever jobs are available in Medina County, what kind of schools we have. My son goes to Brunswick Middle School. He just started. So schools that we have in Medina County are great elementaries. Medina County Preparatory School, Medina County. We have school as such. I think we have five elementary schools. The real estate is great. Touching on that also, we have a lot of ethnic stores in Medina County, Indian stores. We have international food stores, which I frequently visit. I was actually there today. Our churches are phenomenal. We have very, very religiously diverse county. We have the Muslims, the Catholics, the Christians, the Buddhists, every probably denomination you can possibly think of. So, and then also, like I mentioned, our hospital system is absolutely incredible in Medina County and the whole Cleveland, Ohio area. And then the ethnicity, the white population is majority of Medina County. We have about 90%. We followed by 3% African Americans or blacks, 1% Native Americans, 3 Asians, 1 Pacific Islanders, and 2 Latinos. That is reference to Right 2018. We have a lot of places to hang out, meaning restaurants, movies, bars, pubs, entertainment in general. We have a lot of amazing restaurants who were opened back up after COVID. We have a lot of nursing homes. Our latest one is the Avenue at Medina. I believe it's the latest one they just built. We have Elmcroft of Medina, which my very first baby nursing job was Elmcroft of Sagamore Hills, which is another county next to Medina. And the homelessness has improved a lot over the years. We really don't have any stray animals roaming around our streets because everybody's very vigilant and helping each other out. So the community assessment data generation, the 5 causes of death in Medina County is heart attacks, CVAs, strokes, diabetes, cancer of probably any kind generalized, and COPD. there's still a lot of people smoking in Medina County. There's also various organizations established in the community exclusively dedicated to senior citizens. Like I mentioned, a lot of facilities, long-term facilities and assisted livings have gone up. Nursing homes, skilled nursing homes, especially with the COVID-19 pandemic, we've been hit pretty hard. So the community partners and resources, we are Kindred Hospice. The partners, we do palliative nursing care, patients and caregivers. We have very, very good training with them. We have the telehealth team, which is on our home care team, social workers, spiritual guidance counselors, family caregivers. We have all that on board, pretty much every discipline that you can think of. Bereavement coordinators, we actually have anticipatory bereavement, because people know that their loved ones are going to die, and so they need counseling pre-death, pre-passing. We offer very extensive end-of-life care education, if the loved one is in the home, then we are all hands on board. We provide so much medication administration, education, and just end of life process in a very, very gentle way, of course. And that's very helpful too for the family. The community health diagnosis is the target area. Kindred Hospice is kind of like, we're very, very visible in the community. Everybody knows our uniform. Everybody knows what we look like. So for more than about 10 years now, we provide much education and care for the terminal ill patients. And the interventions are given every day. It will implement by the social family caregivers with the patient's permission if they're alert and oriented. The interventions, like I mentioned before, needed anticipatory prescribing of like the grief counselors, things like that. And then we screen them. And I actually mentioned it, and I'm referencing Johnstone 2017. After they are screened, they identify eligible patients, are connected with the telehealth team, and the trained social and family caregivers establish communication with the patient and family. And now it's done face-to-face most of the time, but if there is a COVID case or an outbreak, then we do implement the telehealth. And my next slide is proposed evaluation methods. After the patient passes, we send out surveys, how we did, how we provided the service, and we are surveyed on how we did. It's called a CAP score. And also, like I said, I forgot to mention previous slide, we do give the families, the caregivers, the nurses, the education how to, if the patient can't swallow, how are we going to administer medications, orally, buccally, nasally, or even topical routes such as like transdermal patches. So it's very important. So in conclusion, Medina County is an aging community with significant healthcare issues relating to chronic and debilitating diseases. On average, we of course are only living about 70 years on average if you're healthy or so individual. With COVID, of course, it has been very challenging. So we're trying to do the best job that we can, a lot of hours put in, and we just continue to do what we do. It's just it's been a challenge. So thank you so much for listening.